You ever wonder, how do we get a radiograph on an elephant? How do you give a root canal to a tiger? How do you make a prosthesis for a hornbill? Well, hopefully we'll learn a little bit more about that today as we speak to our director, our chief of animal health. Hi, I'm Ron Magill, Communications Director here at Zoo Miami. Welcome to another episode of Let's Talk About It. Today we're going to talk about our animal health department. Dr. Myers, thanks for joining us.
Thank you so much for having me today.
Well, listen, I think when we think of a zoo veterinarian, we're familiar going to our veterinarian, dog and cat practice, maybe a bird, maybe something else, a guinea pig. But when you think about the zoo, we've got over 2,000 animals here of many, many different species. How do you train for something like that?
Zoo medicine is a specialty, but we're kind of a jack of all trades specialty in that we kind of need to know everything about all of the animals in our care, which is a little impossible. So while we're fantastic generalists, I like to say that we know a little bit about a lot of stuff versus a lot about a little bit. And the perfect example is if someone wanted to become an ophthalmologist, a veterinary ophthalmologist, they'll go through 4 years of college, 4 years of veterinary school, a 1-year internship, and then a 3 or 4 year residency. And then they take their boards and they become specialized in ophthalmology.
So you basically have specialists like we do in human medicine. You have an ophthalmologist, you'd have a heart specialist, you have different specialists in different fields?
As a matter of fact, we do. I think when veterinary medicine first started, it was you're a vet and you're going to see everything and do everything. But now, just like in human medicine, we've become much more specialized in our fields of expertise. We've got medical oncology, we've got surgical oncology. We have boarded surgeons that only specialize in orthopedics. We have boarded surgeons that do both orthopedics and soft tissue, which means they fix broken bones, but they also take out foreign bodies or tumors on the inside. So we are a very specialized career field now compared to where we were a couple hundred years ago.
I mean, you mentioned oncology. Animals get cancer.
Animals do get cancer. And just like in people these days, we can detect it earlier. We do seem to see a lot more cancers now, but that is because we have better opportunities to identify that cancer, something that might have looked like a wart before. Now we can investigate it and find out, is it really a wart or is it a mast cell tumor? And then we have the ability to prolong life. People are living longer, animals are living longer because our care, the nutrition, the preventative medicine, the advancements in medicine and science have allowed our animals to live longer.
You bring up the parallels between animals and humans and the different types of specialized care. I've heard of this One Health. Can you explain to us what One Health is?
One Health is the integration of animal health, people health, and environmental health. And somewhere in between all three of those specialties is the intersection. And so when your environment is not healthy, your animals are not going to be healthy and your people are not going to be healthy. So it is a basic concept of how to identify the connections there and how do we keep all of those things healthy. If we chop down all of our rainforests, we are no longer going to have good air, good water, healthy animals, healthy plants, and healthy people.
When I think of the zoo hospital, I really look at it kind of like as the heart of the zoo. I mean, everything seems to kind of come out of there as far as the general health of the zoo. I walk into the zoo hospital and, I see a respirator with a cone this big. I see different types of tubes, different sized tables, the diversity of equipment. Talk to me about the kind of different equipment that you have to work with from everything from, small birds to big cats.
In dog and cat medicine, there are specific sizes of endotracheal tubes, of catheters, basic equipment that is suitable for those dogs and cats, from the tiny Chihuahua to the big Great Dane. And then in the horse and cattle industry, they've got the same things, but for these larger animals. Well, we have equipment that has to accommodate much bigger and much smaller. So when I'm looking at a tiny bird or a poison dart frog, or it's an elephant or a rhino, we've got to be able to have the equipment to suit their needs as well. Some of it is now manufactured by our companies because they've heard the need and they've been able to manufacture limited supplies of giant endotracheal tubes for us. Other times we have to make it up as we go along. And we've got a really, really creative staff that can say, oh, wait, hold on. Let me pull that out of the recycling bin, clean it, sterilize it, and then make it fit the patient's needs.
Yeah, I've actually seen, and I see the advancements now because now I see actual equipment that's been made specifically for that. But I remember years ago, I remember them taking a 1-gallon jug of milk and using that to go over an animal's face for an anesthesia process. And I see now there are more formal cones and things like that, but there's been quite an evolution of the equipment, I guess.
Yeah, and sometimes it still is going to be that 1-gallon milk jug over their face because it's quick, it's easy, and it's also recyclable.
You talk about an elephant and a rhino. Do you bring them to the hospital when they need to get taken care of? I mean, how do we deal with animals? I don't think we could bring an elephant into our surgical suite.
We would love to, but we can't. What's great about the hospital, it's a enclosed center. We've got a lot of safety and security inside that building. We've got all of the equipment and supplies that we need because the pharmacy's there, the fluids are there, the oxygen, everything's there. But some of our animals we can't pick up, we can't fit through the door, and it's just not safe to move them. And so therefore, we have to pack up our hospital and take it out to the enclosure with the animal. And we do lose some flexibility there, and we lose a lot of the sterility that we gain by being in an enclosed, individual air circularized room. But if I needed to do surgery on a giraffe, which we've done here before, what we're going to do is, to the best of our abilities, clean the space, make sure it is as clean as possible to lay that giraffe down on that tarp or concrete floor. And then we are going to recreate the OR and recreate the lab and recreate the pharmacy.
You brought up something that I think a lot of people don't realize on how much we learn post-mortem and how important necropsies are. What is the value of that?
It is never a fun moment when an animal passes away, whether it is from natural causes and we come in and we find that they have died, or we make the difficult decision to euthanize them, or they die from a disease in front of us. That is hard on the staff, not just the animal staff that has taken care of them, but on the veterinary team that has put a lot of effort into trying to give them the best, healthiest life possible. So we always take a minute to reflect on that and appreciate what we have learned from the animal in its life. Unfortunately, had to necropsy animals that I have helped raise from infancy into their old age state and then made those tough decisions. But once we do start that process and we open them up and we start looking at the systems and identifying, this looked great, this didn't look good. How come this doesn't look good when the blood work says it looks good? And we have to put all of these pieces of the puzzle together to figure out, why did that animal die? What can we do different next time, if there is anything that we can do different? And what will that information do to help us with the next member of that species and the global population?
And not to dwell on animals that die, but I get asked this all the time. What do you do with the animal? Do you bury them? Do you have a cemetery at the zoo? And I understand the compassion behind that, but there are certain regulations, USDA rules that we have to abide by that prevent us from doing that. So what do we do with carcasses once we're done with the necropsy, whatever tissue is being salvaged?
Yeah, we always want to learn. We always want to learn from every aspect of the animals that are entrusted to our care. So once we have done our postmortem exam, we've saved our tissues, some of them go in formalin and go to the pathologist. Sometimes we'll save a duplicate set of tissues. And down here in South Florida, we are not able to bury them. So we do not have a cemetery. In fact, all of the body and the parts go into the incinerator that's right here on site. Now, there are a few exceptions. We try to save the skulls from a few species because perpetually learning. Once we have that skull prepared, where there's no more tissue on it anymore, it's just the bones, we have that in a secured location so that the next time we have a species of that type on the table and we're not sure, gosh, is this the dental arcade? Is this normal? Or did the one that died have an abnormality? Or does this one have an abnormality? We can get the skull out and do a comparison. We can take radiographs, which are x-rays, to look at the different anatomy there and make sure that we're learning from that.
We talk a lot about traditional veterinary medicine, but I know one of the things that you're very involved with now, as well as Dr. Bezjan and a couple of the other staff, is homeopathic medicine that's now seemed to become quite prevalent in the veterinary field. Can you explain a little bit more about that and your feelings behind it?
This is exciting for me, and I wish I could rewind a good 20 years to, early in my career. I confess I had a bit of a closed mind about traditional Chinese veterinary medicine. We were not taught about it in my generation of vet school, and I had a healthy dose of skepticism because I didn't understand it. And a couple of years ago, I hit a moment of frustration because we have challenges with our animals anyway. Yes, they're difficult sometimes to see clinical signs on because they're really good at hiding it. They can be difficult to figure out what's going on when, if I only get one blood sample and I can't touch them again for a couple of weeks or months even, I've only got a snapshot. So we'll take the information and we don't know what's wrong with them. We just know they're sick. So then we'll try treating them. And a lot of times they get better, but then they don't get better and they get worse and they get worse. And it really is, I started thinking, okay, what are we missing here? And that is when I finally had an open mind about traditional Chinese veterinary medicine. And I went and took an acupuncture course up at the Chi University. And I still entered that course with some skepticism. But as I went through the months and months of training there, it did make sense to me.
And we've seen benefits.
And we have seen benefits. Not every animal wants to participate. Not every animal shows a very, very quick response. Like, that's what we want. We want to do something and we want to see immediate satisfaction, immediate responses. But as a whole, traditional Chinese veterinary medicine is not taking the place of Western medicine. We still practice Western medicine here. We use antibiotics. We vaccinate our animals. We do surgeries. And it is an added benefit. So it's just another tool in the toolbox for us to figure out how to best care for these animals.
People often don't think about dental health for their animals. And, quite frankly, I didn't think that much about it until I saw what a huge role it plays here at the zoo. Can you go more into depth about the important role of dental health here at the zoo?
We have dental disease. And as people and animals get older, we have more dental disease. And we might have problems with our younger animals here that chew on rocks, or they get into a brawl and they break a tooth, or they maybe are born with an abnormal tooth. This is not something that we want them to just deal with, okay? And we don't want to mask it by just giving them pain medications to make their jaw feel better. We want to fix the problem. And fixing that problem means I need to look inside your mouth without you taking my fingers off. So while some of the animals can be trained, can work with us and come over up close to their enclosure, and the trainers and the keepers will ask them for an open mouth behavior, some of the animals will comply and open their mouth. And I can see really well in there, and that's still not good enough because I need to take radiographs. Because what we're seeing, these pretty teeth here, is just the surface. It's like an iceberg. There's a whole root system underneath there, and we need to take radiographs of all of those teeth to make sure that we don't have an abscess starting at the base of one of those roots. Because if that happens, then that can not only just destroy the tooth, but there's a fantastic blood supply there. And then there's bacteria growing and entering the bloodstream. In worst case scenarios, that bacteria can travel through the body, and it likes to find a home in the heart and start developing bacteria house parties on the valves of the heart. So very quickly and directly, bad teeth, bad oral hygiene can lead to heart disease and other problems as well. That's where we have a veterinary dentist come in to help us. And that veterinary dentist, the one that we use is Dr. Burning from Ohio, and help us determine which are the cases that she needs to come in and help us by doing a root canal and which ones need to be actually extracted. And that general health is also tied to their dental health.
I think one of the most fascinating things I find about the work that you do in the hospital now is our work in reproductive sciences. I mean, creating the frozen zoo, creating, determining fertility in animals and getting animals to reproduce successfully. How is this knowledge being applied? Because a lot of people ask us, okay, what are you doing at the zoo? How's that helping animals in the wild? And I look at this as a classic case of, wow, this knowledge that we're picking up here can do tremendous amounts.
Some zoo animals are probably easy to breed, right? Maybe our colony animals like prairie dogs or meerkats, they are fairly easy to breed. But putting two tigers together can be a very, very scary situation. So it is a huge risk. The keepers that are working with these animals and trying to understand the behavior, they're the ones that we're trusting to make sure, okay, is this the right time to put these two together? We do need to breed these animals. We have a declining population. We are barely keeping up in the zoo and aquarium worlds with a sustainable population in most of our species. And it's no surprise that the wild counterparts are also in a decline. They're in a decline from poaching, from habitat loss, sometimes from diseases. With our tigers, with our limited population that we have for breeding, because you can't have a pack of tigers. If we've got a male that is a really valuable male because his genetics are not well represented in the population, I think we would want him to breed with a number of females and not just one or two females. We would like his genetics dispersed through the population. It is a lot of money and a lot of heartache and stress on people and animals to ship animals all over the place. But that's what we have to do for breeding, whether it's sending the female to another zoo that has that male or bringing the male here. But looking at reproductive techniques, if we can successfully predict the ovulation in the females and hopefully even help that along with some drug therapy, if we've been able to collect the male, do electroejaculation, as you said, collect that semen, preserve it, boy, it's a lot easier to ship semen to another facility and do an AI procedure on that tiger. It is safer for that female tiger and certainly easier than shipping a 400-pound male several states away to go to a breeding situation.
So I'm going to conclude this episode with probably one of, if not my favorite case here at the zoo in all the years that I've been here. And that's the case of the wonderful hornbill. When I remember that hornbill that diagnosed with cancer, led to having part of her bill removed, and then thinking, gosh, the hornbill's bill plays a role in its courtship and everything. So why don't you explain it? So
we don't get to take full credit for this here at Zoo Miami. There are other facilities that have unfortunately gone through this with hornbills, and it started with some hornbills dying from the cancer that they were getting in their beak, in the upper part of their beak. Then those zoos started seeing funny lesions on these hornbills, then they would intervene early and take them and do advanced imaging, CTs, and realize, okay, where is this cancer? How far has it reached? And they were the pioneers of being able to identify and do a radical surgery to remove the top portion of the beak, because you're trying to remove the cancer. You've got to get clean margins. If you leave a little bit of cancer behind, you haven't really helped the animal because it's going to grow. And then because the horn plays such an important role, they need a prosthetic. They need to have something there while this tissue heals. And they're not going to regrow their entire beak, but they're going to regrow part of it. So we did encounter that same problem here with our hornbill. Sadly found that this was truly cancer, just like the other couple of cases beforehand. We quickly talked to the other facilities. There's 2 other facilities that we were in contact with, and they said, you're going to need to jump on this quickly. You're going to need to do a radical surgery and remove all of that. But at the same time, get a prosthetic made. So we did. We worked with a company, and we were able to have a 3D printed prosthetic. And it was based off of the section that we removed. We sent them the images. We sent them impressions. And once the actual surgical site healed up, we were then able to attach that prosthetic so that she didn't have damage to her sinuses, and we allowed her to heal. She has made a full recovery.
That's a fantastic story. Listen, I could talk to you for days. I'm always fascinated with what goes on in the hospital and the veterinary care here. But I want to end on that high note. I want to thank you very much for taking the time, explaining some of these wonderful procedures and all the challenges that you face and how you meet those challenges. So I'm Ron Magill. Until next time, we'll see you again on Let's Talk About It.